Hey guys, and welcome to our very last lecture. Oh, I'm so excited for you guys to be done with this semester. So this week we are looking at chapter 29, but we're not doing the whole chapter. This is meant to just be a kind of pull it all together little mini lecture. We're going to talk about fertilization, implantation, fetal development, and the birth process. So that's the first I want to say 20-ish pages of the chapter. We're not going to go into the genetics and the more complicated components at the end. I would certainly encourage you to read those at your own leisure, but this week I want you to do just this small bit and then really focus on studying for your final exam. Pregnancy is the carriage of one or more fetuses in utero. So you have one or more babies that you are carrying. The duration is between 37 and 42 weeks, average of 40 weeks, although that 40 weeks, pregnancies are dated from the date of last menstrual period, which is traditionally about 14 days before ovulation. So the actual pregnancy is about 38 weeks after conception occurs. At term, gestation is 37 weeks. So if you're 37 weeks or more, or actually it's more like 36 weeks or more, you are considered a full-term pregnancy. Prior to 36 weeks, you're considered preterm or premature. After 42 weeks, you're considered post-term, and post-term babies have their own set of problems. Everybody hears a lot about premature babies, but post-term babies are going to be really needing more energy than the mother can provide, and so that can result in fetal death. So most doctors and hospitals these days will not allow you to go over 42 weeks. They will either induce or do a C-section. The perinatal period begins from 22 weeks of gestation to 7 days after birth. So a little review from last week. Ovulation, the ovaries release an egg about every 28 days, and that egg needs to be fertilized by a sperm. Fertilization occurs within the fallopian tube, just at the border between the isthmus and the ampulla. And then that fertilized egg has to travel down into the uterus and implant into the uterine wall, which traditionally occurs 2 to 6 days after fertilization. So here we're looking at the ovary. Down here, there's the release of the secondary oocyte. The oocyte gets picked up by the fimbria and then moves along the fallopian tube down into the uterus. So once it gets fertilized, it's going to split, have its first cell division into 2 cells, and then the next split will be 4 cells, and then you'll continue to split until it becomes a monule or morula, an advanced morula, and that's when it is a large grouping of cells that then is going to get embedded into the lining of the uterus. There are some signs of early pregnancy that we watch for. The presence of human chorionic gonadotropin occurs in the urine and the blood after implantation when the oocyte begins to release this HCG. The purpose of human chorionic gonadotropin is to maintain the corpus luteum, and it keeps the corpus luteum producing progesterone, and the progesterone helps to maintain the pregnancy. So in early pregnancy, HCG levels are low, and then they rapidly rise in the first few weeks of pregnancy in order to maintain that corpus luteum. A missed menstrual period is important. Once you have implantation that occurs, the lining of the uterus must stay vascularized, and so periods cease. If you were to get your period, you could potentially slough off the part of the uterine lining that contains the fertilized egg. Increase in basal body temperature. So we saw that last week when we were looking at changes throughout the ovarian cycle. And so the surge in luteinizing hormone increases your basal body temperature through additional progesterone release. And so with the progesterone levels remain high when pregnancy occurs, so that basal body temperature is going to remain high. If implantation did not occur, that basal body temperature would drop again at the time when the menstrual cycle was going to begin. You can also have darkening of the cervix, the vagina, and the vulva, softening of the cervix, softening of the uterine isthmus, and darkening in the midline of the abdomen, which is called the linea nigra. So remember we have the linea alba, which is that white line where the two rectus abdominis come together. So this is a linea nigra, which is a darkening of the line traditionally from the belly button down, that midline of the body. So this slide is going over the HCG again. So it can be detected in blood and urine about 12 days after implantation. The fertilized egg is called the blastocyst before it implants, and once it implants, it will start to secrete the HCG that stimulates the corpus luteum to produce progesterone, maintain the lining of the uterus, and nourishing this new growing embryo. The term gravid, it means pregnant. There are some other terms here. So gravida is a pregnant woman. Nulle gravida is the woman who has never been pregnant, or a woman who has never held a pregnancy to over 20 weeks. So even if you've been pregnant but have not been able to maintain a pregnancy over 20 weeks, you would still be considered nulliparous. Prima gravida is a pregnant woman for the first time. So if it's your very first pregnancy, it's your prima gravida. Multigravida is a woman who has previously been pregnant and is now pregnant again. So parity is the number of pregnancies that a woman has had to 20 weeks. So this includes any current pregnancy, miscarriages, or stillbirths that have occurred post 20 weeks. So if you've never carried a pregnancy greater than or equal to 20 weeks, then you are considered nulliparous down here. Pregnancy occurs in 3 trimesters, each about 3 months long. The embryo is the developing offspring during the first 8 weeks of life following conception. So the embryo is the first 8 weeks following conception. After 8 weeks, then it becomes a fetus. And it's a fetus up until birth. So in the first trimester, which starts at the date of last menstrual period and lasts for the first 12 weeks, there are multiple different events that take place. First, we have cleavage, which is a sequence of cell divisions that begins immediately after fertilizations. From here, we start out as a blastocyst, become a zygote. Let's start over. We start out as a zygote. The zygote becomes a pre-embryo, and the pre-embryo becomes a blastocyst. So that's everything that's happening like this, and we end with our blastocyst, and the blastocyst is what is going to implant. So the second stage is implantation. so the attachment of the blastocyst to the endometrium of the uterus. The third stage is placentation. So this is what happens when the blood vessels start to form around the blastocyst and creates the placenta. The placenta is a complex organ that permits exchange between the maternal blood and the embryonic blood, but never allows them to intermingle. So it keeps them separated, but allows the fetus to get what it needs and to deliver waste products back into the maternal circulation. The fetus and the placenta become connected through the umbilical artery, which carries deoxygenated blood from the fetus to the mother, and the umbilical vein, which carries oxygenated blood from the mother to the fetus. And the fourth event in the first trimester is embryogenesis, and that is the formation of a viable embryo. So the blastocyst becoming an embryo. By the end of the first trimester, all of the foundations for all of the major organ systems have been created. That's termed organogenesis. So it establishes the foundations for all major organ systems in the first trimester. The first trimester is the highest risk trimester. So we have the highest risk of miscarriage during this period. There are so many different things that can go wrong, and actually only 40% of pregnancies are carried full term. And so that's a staggering number, that 60% of pregnancies are lost prior to a full-term birth. So many times the loss is so quick that the woman probably won't even know that she's pregnant. But then you can miscarry all around, all throughout pregnancy, but the bulk of miscarriages occur within the first trimester. There are a lot of changes in the mother's body during this time, most commonly breast tenderness, darkening of the nipple and the areola, and enlargement of both, increased urinary frequency from pressure on the bladder, fatigue, extreme fatigue, nausea and vomiting or morning sickness, and constipation and or cramping can all occur in that first trimester. After implantation of the blastocyst, the uterine endometrium is called the deciduous. The placenta is formed by the deciduous and outer layers of the embryo connected to one another. The umbilical cord forms, and that connects the embryo or the fetus into the placenta. The umbilical cord houses the umbilical artery and the umbilical vein. And growth and development is really rapid during this first trimester. Like I said, by 10 weeks, all of the body parts are present, and the placenta has developed to supply nutrients and remove wastes from the fetus. The first trimester is the period of embryological and early fetal development, and where the rudiments of all major organ systems appear. So here's a picture of an embryo at week 4, and you can see that it is still pretty much a little blob. It's got an eye here. You have the early beginnings of the brain up here. The ear is way back there. So you have a nice tail wrapping around like that. So not yet quite resembling a human at week 4. By week 8, you can see a huge change. Now all of a sudden, this looks like a tiny little person. So 8 weeks in, you can see the eye has darkened and the ear has come up behind it. There's a lot of brain being formed. The tail is gone, and now you have little leg buds and arm buds and even little tiny toes at week 8. You can see the umbilical cord really nicely here, and then the attachment to the placenta out there. And then by week 12, you have what looks like a tiny little alien baby. So you've got, and you can see the brain developing, the eyes, the little fingers and toes, and the umbilical cord all within what's called the amniotic sac. So this is the amnion, and then it's full of amniotic fluid, and the fluid is bathing the baby. During the second trimester, we have a lot of development going on. So the second trimester starts at 14 weeks and goes through the 27th week. The mother starts to display outward signs of pregnancy with an increasing abdominal size. And then additionally, this is when some women start to become to have a lot of pain associated with pregnancy. So you can have pain in your back, your hips, your pelvis, because your ligaments tend to relax through the release of a hormone called relaxin. You really want these ligaments to relax because it allows for the opening and expansion of the pelvis during the birth process, but it also makes everything else just a little bit less stable during pregnancy, and so it's easy to end up in pain. The fetus is changing a lot in the second trimester. The bones are starting to calcify. The organs are maturing. Amniotic fluid is being swallowed and passed through an immature digestive system. The urinary system starts to work. And by 19 weeks, the fetus is covered with that lanugo that we learned about in A&P1, that very, very fine hair that premature babies are born very hairy because they're covered with that lanugo. Generally, full-term babies shed the lanugo in utero prior to birth. So the second trimester is dominated by development of the organs and organ systems. The development of the organs is pretty complete by the end of the 6th month, and body proportions and shapes are going to change a bit, but the fetus looks distinctly human by the end of that 28 weeks, or the end of 27 weeks, and at the end of that second trimester, babies born that prematurely can often survive. So there we've got a baby in the second trimester. The third trimester is from the beginning of week 28 up through delivery. In the mom, the breasts are continuing to grow and prepare for lactation. The mammary glands are starting to produce colostrum, which is that early breast milk. The mother is going to be gaining additional weight. The fetus in the third trimester is mainly gaining weight. It's rapid growth and deposition of adipose tissue. And the fetus is going to grow from about just over 1 pound to an average of about 7 pounds throughout this third trimester. So they're really just gaining weight during this third trimester. As the fetus gains weight and grows in size, they can press on the lungs and create shortness of breath or difficult breathing. They can also press on the bladder, create increased urination or constipation. The mother's skin is going to start to stretch, and stretch marks may appear if the skin is stretched past its elastic limits. And Braxton Hicks contractions occur, which are considered false labor or practice contractions. They are just spasms of the uterus, but they don't stay around. They're not unrelenting like real labor. So they're just uterine spasms. They're not regular and they're not persistent. So this is, I think, really cool that they figured out how big the baby should be, where the top of the uterus should be at each month. So you can see from 3 months to 9 months how much the uterus is growing each month. And you can actually measure that from the pubic symphysis up to where you feel the top of the uterus. And so the doctors can check and see if the baby is growing on track without having to do ultrasounds on a regular basis. At the end of 9 months, you can see that this line here, that dotted line, is when the baby drops down into the pelvic cavity in preparation for delivery. then you'll go from this original 9-month line back down to almost about the 7-month line when the baby settles deep into the pelvis. The third trimester marks a period of viability. So viability means when the fetus can actually survive outside of the mother's body. The head's going to drop into the pelvic cavity like we just discussed, increases pressure on the bladder, but it also takes pressure off of the lungs and makes breathing a lot easier. The fetal lungs are going to mature during this time. They're typically functional by 32 weeks. Prior to 32 weeks, they're not producing enough surfactant, and so babies that are born under 32 weeks traditionally have to have injections of surfactant to keep their lungs expanded. They're starting to get more hair and their fingernails start to grow, and they're able to open and close their eyes in the third trimester. So the third trimester is characterized by rapid fetal growth, mostly adipose tissue. The major organ systems become fully functional pretty early on in the third trimester, and so an infant born even a couple months early can still survive, especially now with our neonatal care units. So once the fetus is fully mature, childbirth is the way that the baby is born. It's also called parturition, P-A-R-T-U-R-I-T-I-O-N, and that is the forcible expulsion of the fetus. So uterine contractions are what signal the beginning of labor. We have effacement and dilation at the cervix. The fetus is going to drop down into the cervical canal. Uterine contractions are going to be rhythmic and regular and get closer and closer together and last longer to push the infant or the fetus down into the birth canal. A C-section is an abdominal delivery where an incision is made in the lower abdomen and the baby is removed surgically. That can happen if there's fetal distress during delivery, if the fetus is too large to pass through the mother's pelvis. There are multiple different reasons. If your baby is in a breech presentation, then they often now recommend a cesarean section over a vaginal birth. So the process of labor, we have multiple stages. So stage 1 is dilation. So in dilation, we've got, this begins the onset of true labor and the opening of the cervix. So dilation is the opening of the cervix. So here you can see the cervix is closed, and over here you can see the cervix is opening as the baby's head is pressing into it. This is also when the amniochorionic membrane or the amniotic sac is going to rupture. Most commonly we call that the water breaking. So that occurs at this stage, so at the end of dilation or stage 1 of labor. Stage 2 is expulsion, which is the actual delivery of the fetus. At this point, contractions reach their maximal intensity of contracting every 2 to 3 minutes, and those contractions lasting about a full minute, and the fetus then emerges from the vagina. And the third stage is the placental stage, where the placenta is going to detach from the uterus. The contractions of the uterus are going to detach the placenta from the uterine wall, and then the placenta needs to be delivered as well. So that's the placental stage. Puerperium is the postpartum period, which is the 6 weeks following the birth of the baby. During this time, oxytocin is released, and that aids in lactation and breastfeeding. Breastfeeding is ideal for newborns because even though formulas now they can have a very similar consistency to breast milk with all of the nutrients that the baby needs, breast milk contains the immune cells of the mother's immune system, all of the antibodies that the mother has. And so it really helps the infants fight off infection versus formula, which does not have any antibodies. And remember from the lymphatics, when babies are born, it takes about 6 months for them to develop their own immune system. So breastfeeding in that first 6 months can be very, very helpful in protecting the baby from infection during that time. So that's the end of our lecture. We are done with A&P 2. So this week you're going to be watching the Life's Greatest Miracle, which is on the Canvas site. That movie, I will say, does have some graphic visuals of the birth process, but it is very, very interesting to watch how this all works and to see it all in pictures. So you're going to watch that video and then you're going to post in the discussion board and just talk about the 5 things that you learned in that video that you thought were the most interesting. And then next week is the final exam. So make sure you get all your studying done, use the final exam review sheet, and I'm going to miss teaching you guys as a class. So you guys have a great week, and I'll see you next week for the final.